I'm Jay Chatterjee. I'm a consultant gynae-oncologist and a gynecologist. My subspecialty is gynae-oncology, which is looking after women with female cancers. I have a subspecialist role in the NHS, and I work at the Royal Surrey Hospital, which is a cancer centre for most of Surrey, and that's where I perform complex cancer surgery for women with ovarian, cervical, endometrial, vulval cancer. We also do fertility preservation surgery for women with early cancers. We also counsel women with family history of cancers, where we see there's a role of risk reduction surgeries. My private practice is based in London and in Surrey. I look after women for all gynecological problems as well as for gynae-oncological problems. At the Surrey Park Clinic, I'll see patients with abnormal smears or any other gynecological problems like abnormal bleeding, pelvic pain, abnormal vaginal discharge, if they have got any other symptoms such as prolapse, with any other benign gynecological conditions. I obviously see patients who come with concerns regarding whether their symptoms related to any underlying malignant pathology like abdominal bloating, loss of appetite, if they have any kind of bleeding after sex. So these are the patients from a very broad spectrum who I'll see at Surrey Park Clinic. So the way the screening program for cervical cancer works is that you're screened by having a smear to see if you've got abnormal cells or high-risk HPV on that smear. If any of that comes back as positive, you're referred for a colposcopy. So colposcopy is where we look at the neck of the womb with a magnified camera by putting some dye on the cervix, which we call as acetic acid, and then depending upon how this causes changes on the cervix, we look at it through a magnified camera called colposcopy. We then take biopsies using the colposcope, and depending upon the grade of abnormality, we'll do treatments, which is where we use electric wires to excise the abnormal area. So Surrey Park Clinic has got a fantastic colposcopy suite where we offer the entire spectrum of treatments and managements in colposcopy. We can also do vaginoscopy if you have vaginal lesions, or vulvoscopy if you've got vulval lesions, and you get referred to us with an abnormal smear or any symptoms, and then we do a colposcopy and monitor you at the Surrey Park Clinic. If you're worried about symptoms such as postcoital bleeding, if you have excessive vaginal discharge, if you're getting bleeding in between periods, all these symptoms should prompt you to either come to us where we can perform smears or do scans to see whether it's related to the cervix or to the lining of the womb or the womb, and then depending upon what that shows, we will be able to treat you effectively and arrange colposcopy appointments and see you at the colposcopy clinic at the Surrey Park Clinic. So in the Surrey Park Clinic, we've got a very relaxed environment. People are friendly, the clinicians are friendly. You've got highly skilled clinicians who are very well known, not only locally, but also nationally and internationally. So you would be seen by somebody who's been doing the clinical work for a very long time and is very experienced. So you will have a fantastic care. The process is very smooth. You get an appointment straight away. There is no waiting time to see any of the clinicians. And once you're in the clinic, the treatment and the management is almost seamless. So these are the advantages of coming and seeing us at the Surrey Park Clinic.